Hi, I'm Katy Welty. I work for Polara Health. I have been working for Polara for 15 years. I've been a client there for 23. And I would like to talk to you about behavioral health. Polara believes in the recovery method of behavioral treatment. That means it's a process of change in which the person with the behavioral disorder goes toward wellness. There are 4 main dimensions that support recovery. First is health, physical and mental health, home, having a stable and safe place to live, purpose, having a reason to get up in the morning, and community, that social connection that we all need. Recovery values are important, and there are a lot of them. The most important one is respect. You want to meet the client where they are with total acceptance. The other side of that coin is hope. While you are meeting the client right where they are, you also want to hold that hope for them that they will get better, because sometimes when they're with us, they don't have that hope. We have to hold it for them. The clients have to receive services that are their choice. The process of recovery is highly personal and occurs via many pathways. The road to recovery is never a straight line. It will always include setbacks. So as a behavioral health treatment center, we have to be resilient. We have to teach the clients resilience. And our resilience is really important, because you can be with a client who takes you into some pretty dark places, and then you'll need to see another client in 45 minutes. So everyone needs to focus on their resilience. Because of that, all of our treatment has to be flexible to follow the client's path. This is the essence of peer support. A man is walking down the road and he falls into a hole. He's crying out for help, and along comes a minister. And the minister writes out a prayer, drops it down in the hole. The man is still in the hole. Along comes the doctor, and the man is crying out for help. The doctor writes out a prescription, drops it in the hole, but the man is still in the hole. And along comes a peer, and the man is crying out for help. And the peer jumps down into the hole with the man. The man says, "Why did you do that? Now we're both in this hole." And the peer says, "But I've been in this hole before. I know the way out." At Polara, we have a very robust and large peer team. We work with individuals. We work with groups. We have a day program that is staffed with peer supports. We attend appointments with our clients. Behavioral health is a very tricky part of medicine in that there is no x-ray, there's no blood test. The doctor can only prescribe correctly based on what the client tells them. I know I sometimes go to a doctor and tell them what I think they want to hear, so that doesn't work with behavioral health. We'll go there with our clients to make sure everything gets brought up. We do crisis work at our Crisis Stabilization Center. Peer support is the first person that talks to the client when they come through the door. We educate about recovery. I actually do this presentation on a nationwide basis, and it's really important because everyone needs to learn about the stigma that surrounds mental illness. We partner to support our unsheltered clients. Mostly two things. We ensure that the client's voice is the loudest one at the table, and we give unconditional acceptance and hope to the clients. When we are sitting with a client, they can talk about, my family disowned me because I have a mental illness. And we can say, yeah, mine too. Peer support works so well, and it's so important for one main reason. Those of us who have been in recovery have been helped along the way by lots of people. And now that we are working, we want to pay that help forward as gratitude for the help that we've gotten. So I have a team that is not doing their job, they're doing their dream job. We've developed the gift on how to work with a mental illness. We know that you can move from hopelessness to hope. And the more people in society that disclose their mental illness, the more we can fight stigma. Stigma is a mark of disgrace associated with a particular circumstance, quality, or person. I'm going to talk about provider stigma, which is negative attitudes, beliefs, and behaviors of mental health providers toward the clients that they serve. Why would we stigmatize our own clients? I mentioned that behavioral health is one of the trickiest fields of medicine to work in. Acuity of our clients. At my agency, we get the clients that nobody else wants, and we do that with pride. The nature of mental illness is the reason for the stigma and the reason that behavioral health is so hard to work in. All mental illness is chronic. I mentioned before about having to follow a flexible path. So you will have a client and he will be getting better and better. And they've got a job and social interests. And then they're in the hospital with a suicide attempt. 3 things you can do when that happens. The first is blame ourselves. Obviously, our treatment didn't work. That's never a good idea. The second is to blame the client for getting ill again. And that is what really increases stigma. And the third way is just to realize it's the nature of mental illness. The next section of mental illness is really powerful, and that is because they call it behavioral health, because symptoms come out in behaviors. The whole world judges people on their behavior. With mental illness, sometimes in our clients, the behaviors are not a choice. And the last thing is that anyone immersed in their mental illness symptoms have a largely compromised judgment at the time. So we're talking about clients who are high in acuity. Their disorder is chronic. It keeps coming back. Their behaviors are looked at as unacceptable. They have little or no judgment, and yet we expect those clients to make brilliant treatment decisions. That doesn't always help. That's our job, to be certain that the client knows from us what is working and what isn't. So those three things are the reasons why people stigmatize mental illness. We all have a huge amount of work. Who doesn't? But also secondary trauma or compassion fatigue will make staff more stigmatizing to their clients. So I want to talk about compassion fatigue. It can take a physical, mental, and spiritual toll on the workers. There are symptoms of it: feeling burdened by your clients, blaming clients for their illness, isolating, drugs and alcohol, fatigue. And the manifestation of this provider-based stigma always increases the amount of stigma that the client is facing. Stigma brings experiences of shame, self-hatred, bullying, discrimination. The very worst part of stigma, though, is when our clients have been so stigmatized, they believe it. So they carry that self-stigmatization with them everywhere they go. Stigma has consequences, far-reaching consequences. It is the biggest barrier to mental health care. Clients who feel stigmatized by their providers are not going to get well from that treatment. 60% of people, though, will never get any treatment because they don't want to be thought of as crazy. I was working at a peer-run agency, and a client came in. His name was Will, and he was ill. He had some kind of upper respiratory thing. He was wheezing when he talked or breathed, and we all told him to go get help. He went to the emergency room. The doctor there saw that he was taking Haldol, which is a strong antipsychotic, and that he was diagnosed with paranoid schizophrenia. The doctor told Will to go to the psychiatric hospital. Will drove himself there. The staff at the hospital were aghast at how sick Will was, and they sent him back to the ER in an ambulance. But he died. This is why people don't want to admit that they have a mental illness. Stigma can actually kill. What can we as staff do? Really, it just all comes down to losing the judgment, support clients in making good treatment decisions, make it okay that their judgment is diminished, make it okay for them that some of their symptoms have come out in behaviors while still holding them accountable. And again, just vow to lose the judgment. We can also watch for stigma enforcing attitudes and language. Many of you have heard the phrase frequent flyers for people who are rehospitalized often. The Journal of the American Medical Association calls that disrespectful and stigmatizing. It is extremely disrespectful, and it throws a shade on the client getting well from any treatment we give them. There are other words that we use, perspectives that need to be shifted. I'm going to talk about just a few of them. We call people attention seeking. And first of all, when I'm ill, I want to seek attention too from my doctor. But we also have clients who panic when they think they're being ignored. I have one client who actually called me 60 times in one day. And that can be annoying. I couldn't do my job. But I know that this client was actually locked in a closet for hours when she was 7 to keep her father from assaulting her. When our clients seek attention, there's usually a reason. We call people drug seeking, and the phrase, they just want their benzos, is something that we hear a lot. And here's the situation. You've got a client who has anxiety so bad that they can't leave the house. We give them a pill. All of a sudden, their life gets well. They can go into social situations. They can get jobs. And so we denigrate them for wanting to get more pills. That doesn't work. It's not fair. Borderline personality disorder is something that we call clients that we want to insult. Survivor personality traits is what I call it in the DBT classes I teach. DBT is a modality that was founded to treat borderline personality disorder. So On the very first day of class, I tell my class, you have all been diagnosed with something that includes as a symptom, treatment interfering behavior. So, prove them wrong. Come to class. We call people non-compliant when they're not taking the medication we prescribe for them. First of all, let's talk about psych medication. The side effects are awful. On one hand, you can be so depressed that you can't function. And on the other hand, you lose your sex life, sleep all day, and gain 50 pounds. So some of our clients pick depression. When we treat clients that they are failing due to relapse, we are setting all of them up for failure. We already talked about the chronic nature of mental illness. The one that really gets me, and I have seen this in emails and meetings, and that is they just don't want to get better. And this is a client who no-shows or stops taking their medication. We already talked about the faulty judgment and insight. And again, it's up to us to treat clients and give them insight from our perspective when they don't have that judgment for themselves. The last one I'm going to talk about is that client is impossible to work with. We have clients that are really hard to work with, but that's why we get paychecks. That's why we love doing this job. It's just an opportunity to show how skillful we are. The good news is, as you eliminate stigma in treatment settings, your community is going to have increased health. If your community has increased health, what does that do to all the other communities? When those all have increased health, what does that do to our state and beyond? This is how you change things. This is how you change the world. So finally, I would like to close with a personal story. When I first became a peer support for a provider clinic, I had other peer supports tell me I was selling out. It would change me. I would just be another medical provider. And at the same time, the clinic did not accept me as a staff member. I had case managers tell me, you need to keep your door closed because you are a client and you shouldn't hear us talk about other clients. So fast forward 15 years. I have a team of 17 peer supports. I have done this stigma presentation for every single staff in our agency. My CEO made it mandatory. And we were in a meeting where we were deciding what few words would sum up who we are as an agency. And everybody in the room talked about losing judgment, talked about accepting the client right where they are, and talked about fighting stigma. And it took my breath away, because then I realized I had changed them.